Hi, my name is Maricela and we're going to be talking about stress today. I'm from UT Tyler Occupational Therapy Program and we're talking about stress today. Stress is something everybody faces in their day-to-day life. And we're going to talk about what assessments to take and how we can cope with it. So down below there are two links I will post underneath my video caption, and these links will be just links you can do assessments, and you can see what your stress level is. So I personally took two assessments. The assessment I took was called Coping and Stress Management Test, and unfortunately I scored problem-focused coping. I'm not afraid to admit it, but I am diagnosed with ADHD, anxiety, and depression. So I think because I scored poorly is just because I do struggle with stress, and I do use medication to help with that. And this is something recently I just discovered this year. So I am on a journey, on a pathway to wellness. So the other assessment that I took was called the Perceived Stress Scale. I'm actually putting one, like I said, down below so you can take it yourself. It's from 1983. I scored a 30 out of 40, which just means I have high perceived stress. What areas of your life currently cause you the most stress? Right now, it is the struggle of working, being a mom, being a student, being a wife. The combination is insane. Also, I just had a diverticulitis flare-up, so that's another stress factor. I was in the hospital for 2 days. So like I said, it's everyday life that's stressful for me. So like areas of my life would be just my role. So role as a student again, role as a mom, role as a wife, role as a therapist at work. And so that's what's currently stressful for me. So what means of coping do you use to deal with stressors? So I typically go to the gym. The gym really helps me mentally. I also like reading. I'm big into fantasy and romance novels, so that helps me. I do need to work more on breathing techniques, especially when I'm stressed, and so that's something I'm learning, and I am on my journey. Okay, I want to go over coping strategies real quick. I tend to use avoidant coping, which is one you don't want to do. Is I procrastinate or emotionally withdraw when I feel overwhelmed. A good kind of coping that I do is called adaptive coping, and that is to promote overall well-being, and I do that by exercising, what I just discussed earlier. What my goal is to focus on problem-focused coping, maybe actively figuring it out and thinking. So does it cause us much stress? And also I would like to do emotion-focused coping, which is the relaxation and breathing techniques and then meditation. So if you're a therapist designing an intervention for yourself, what approaches would you take and why? If you really want to know, for me, I would take the behavioral approach because I want positive reinforcement. I want somebody to tell me, hey, you're doing a good job. And you know what? I want a little reward, even if it's a gold sticker or maybe a book. But no, realistically, I think I would have an occupational based approach. Maybe I'd structure my weekly routine and to include meaningful occupations, saying, hey, if I'm more structured, if I can do my assignments, then I can do X, Y, and Z. I can be able to do my walk. I can be able to do more things. So I think it would be more a healthier balance. So occupational-based approach would probably be the more correct answer, but I really like that behavioral approach. Let's do 3 realistic occupational therapy goals for myself. So if I were to create 3 goals, the first one I would say is I will use a daily planner to schedule school tasks and home responsibilities for the next 4 weeks to improve my overall time management. Number 2, I will engage in one meaningful leisure activity, say my exercising, or maybe I can incorporate that yoga for mindfulness for at least 30 minutes, 3 times per week to reduce emotional exhaustion. Okay, so for exercising, I really just want to put walking for 30 minutes. because I already strength train. I already do that. So my goal would be walking or yoga for mindfulness. My third goal, I will practice a 5-minute breathing or grounding technique 4 times a week when feeling overwhelmed to improve stress regulation, to improve my overall independence. That third goal will be the hardest goal for me. I think all the other 2 I can do. The third one will be a challenge. What barriers do you anticipate in achieving your goals? Barriers probably would include my procrastination. I'm not great with time management. Sometimes there might be unpredictable events because I have kids and I have events. Another barrier would be just negative thinking sometimes, which I need to establish more positive. How could you be proactive in addressing these behaviors? Well, I can do positive thinking. I can set more phone reminders, be more organized, have a calendar, a planner would be great. Maybe ask for help. That's a big one. Like ask more support from our friends. Assignment is called Coping and Mental Illness. These are actually like scenarios and what would you do? And so this is really nice because it gets your thinking cap on. So let's go with it. Bob is a 32-year-old male on the surface, returning from the Middle East. He witnessed 2 of his friends killed in a car bomb accident and has since had several symptoms of PTSD, including flashbacks, difficulty sleeping, inability to concentrate. His symptoms have recently interfered with the relationships with his friends and his fiancée. Bob's physicians recently referred him to occupational therapy. So the first thing I would do with Bob, I would build rapport. He has just went through a traumatic event. I would make sure to emphasize his strengths about his military service. We want to really regain daily function and control. So assessments I might use is the COPM. I think we need to assess and identify his performance issues and goals. Maybe do a role checklist to see what he enjoys besides just the military. And then for intervention focus, I would establish coping strategies. Definitely breathing, mindfulness, and I would make sure to do structure routines as he isn't from the military, so he would probably like a really good structure, maybe an outline, and just really engage in stuff that's meaningful. And hopefully this will improve his overall focus and his mood. All right, next scenario. Tom is a 13-year-old male who was referred to a pediatric occupational therapy clinic. He has struggled with depression, anxiety, and learning difficulties. He is angry and does not wish to partake in treatment. So this is kind of a hard scenario because this is a teenage boy. We would try to do play-based, but I think at that age is mostly electronics. So personally, I think I would like to do maybe like scenario cards. And as far as play-based that I mentioned earlier, maybe like a sport, have him involved in sport and just build that rapport with him and that relationship. As far as assessments, I probably would do the sensory profile. I completely believe like he has sensory deregulation, at least that's expected, and so I would want to do an assessment on that. I would also maybe do some like questionnaires for the parents and the teachers to see what he likes and he enjoys and what his schedule is, his day schedule. My intervention focus would definitely be like coping strategies, breathing, maybe like a little stress ball because he has anxiety, depression, so he needs something to feel safe. So a stress ball I think is really nice to have. And we really need to build his confidence. So I would build his confidence by just finding something he enjoys. And also, I think it's really important, since he's a 13-year-old boy, we really incorporate like the family and the school. For OT, we need to make sure to reach out to everybody in this, because it's a teamwork situation, and we just need to all collaborate to reinforce coping strategies in his daily life. And that's what I would do for him. Next scenario. Sue's a 22-year-old female with alcohol abuse and unspecified eating disorder. She's been referred to you for evaluation and intervention. She lacks positive coping skills and tends to isolate, drink, and binge on food to deal with the increased stressors from college and home life. Lastly, I would maybe seek a nutritionist, another specialist, or maybe like a support group in the area. I think it would be great she had found friends. Lastly, what I would like to do for Sue is I would like to probably seek a nutritionist, a nutrition therapist to help with her eating. And I would also like to do find a support group in the area, someone who maybe went through this already, so she has somebody to talk to. And that way she has support, someone around her age. So that's what I would do for Sue.